Hi, everybody. Welcome. Come on in. We'll wait a few minutes just to let everybody in. I know it's beautiful outside. Andrea and I were just talking that people are probably going to be, because of cabin fever, outside today. So not sure what the attendance will be like today, but we will wait just about a minute or two and get started. But thank you for being here today. Okay, so I'm going to go ahead and get started. I know we have a little bit lower attendance than what we typically do, but for the sake of keeping on schedule, I do want to make sure that we stay on task. So thank you for being here for Chamber University today. It is brought to us by PeriProtech and Sheakley. And with us today, we're actually going to be talking about what is managed care organization and Ohio's workers' comp. We have with us today, can everybody see my screen? Hopefully, yes. We open enrollment for MCO, which is managed care, begins Monday, May 3rd, and then it actually ends next Friday on the 28th. And during this time, Ohio employers, sorry, I'm talking a little too fast, can choose a new MCO. And today we have Audra Keener, she's the Director of Client Programs from Sheakley, that's going to be discussing a little bit more in detail of what that looks like. If you have questions, please use your chat box at any time. I will help facilitate that, and I will also be helping Andrea with the slides. So I'm going to turn my camera off, but Andrea, thank you for being here with us today. We really appreciate it. This is a lot of great information, and I'm going to go ahead and turn it over to you.
Thank you. Thank you for that introduction. And yes, thank you everybody for taking the time to join us today. I will review Ohio Managed Care Organizations, or MCOs, and their role within the Ohio Workers' Compensation Program. So next slide, please. We'll start off by discussing what is an MCO. Managed care organizations, MCOs, are private companies selected by or assigned to each state-funded Ohio employer. And we medically manage the workers' compensation claims of injured employees. Currently, there are 10 different MCOs, including Sheakley Unicomp, and the next slide will show you a list of the different MCOs that are currently contracted with the state of Ohio. Okay, the next slide then. And then now we'll go over why you need an MCO. Many of you may not know that you already have one, but the Ohio Bureau of Workers' Compensation, BWC, does require every employer that's covered by the state to have an MCO, even if you don't have any workers' compensation claims. There's no out-of-pocket fee for MCO services. We are paid directly from the BWC using a portion of the premiums you, the employer, pay for workers' compensation coverage. And then we'll go to the next slide. So how do employers select or get assigned an MCO? When an employer applies for workers' compensation coverage with the BWC, they are assigned a temporary policy number, and then several weeks later, a permanent policy number. Once the employer receives the permanent policy number, they have about a 30-day window to select their MCO. If an employer doesn't make a selection for their initial assignment, the BWC will randomly assign an MCO to the policy. After the initial assignment, the only time an employer can change their MCO is typically during an open enrollment period. Open enrollment usually occurs every 2 years. It was scheduled to take place in 2020, but due to the COVID-19 pandemic, it was postponed to this year. So we are currently in the 2021 open enrollment period. It began on May 3rd, and it does end next Friday on May 28th at 5:30 p.m. Many of you have probably already received some marketing materials or calls from some of the MCOs, so you're well aware that we're in the open enrollment period. The BWC measures the different MCOs in several categories. They publish an MCO report card, which can be located on the Ohio BWC's website. If you're interested in seeing how each MCO ranks in those different categories, you can go to the BWC website to review a copy of the 2021 MCO report card. Now we'll go on to the next slide. And now I'm going to talk a little bit about what MCOs do for employers and why it's important to have an MCO in the success of your business. Every MCO is contracted with the BWC to provide medical management services for Ohio Workers' Compensation Program. This is a list of some of those duties that we perform for employers. We take care of the injury reporting. So when you have an injured worker injured at work, you can call us. We can take care of all of that. We obtain the initial claim data through that injury reporting process. We gather medical records throughout the life of the claim. We review medical bills and then we authorize the payment of those bills. We also review treatment requests and then either approve or deny the treatment. We also have vocational rehabilitation services. We provide education for employers, the injured worker, the medical providers about the health partnership program, which is the partnership between the BWC and the MCOs. We'll go on to the next. Another important responsibility of your MCO is to look for cost containment opportunities while not sacrificing the quality of care for the injured employee. There are several ways we, the MCOs, can do this, and some of them are that we provide a network of BWC certified physicians with rates below BWC fee schedule. So that just means that the medical bills are repriced at a discounted rate. We also do medical bill review, ensuring the billed amount is correct and appropriate. The utilization review confirms that the treatment requested is necessary and appropriate for the allowed conditions of the claim. We also have different return to work strategies that assist the injured worker to get back to work as quickly and safely as possible, such as transitional work, utilizing a nonprofit agency for off-site return to work, accommodating modified duty restrictions, as well as others. Another way MCOs can look for cost containment opportunities is providing different reports to help employers track and monitor different areas of their data for their workers' compensation program. Here at Sheakley, we do have a variety of reports that include our injury trend report and our industry-specific report. Our trend report immediately identifies injury frequencies and types. There are many trends on the report, which gives employers information on areas. Some shows where employers are performing really well, and some others are areas of improvement. We also have our industry-specific report, and this report gives an employer a snapshot of how they're performing in different categories, but compares them to employers in the same or similar industry. So if you're in the manufacturing industry, you're compared to other employers that are classified as manufacturing as well. Excuse me. We capture statistics in different areas such as lag time, lost time ratio, average cost of claims, and others. So this also allows employers to identify areas that are good or not so good. And then we have what I like to call our preventable injury report. So this shows different injuries that could have possibly been prevented, and then the medical costs that could have potentially been saved, and different strategies to prevent them. So we had an employer where we identified a handful of injury types that we felt could have possibly been prevented, like slips, trips, and falls. Then we let the employer know how many claims they had for each of the injury types, and then the medical costs associated with those claims. Then we provide suggestions on how we think you could possibly prevent these injuries. So for the slips, trips, and falls, they had a lot of falls on ice, so we suggested anti-slip shoes. We also suggested that they conduct a general office safety walkthrough to move things like loose cords. And for one employer, we even suggested painting the steps a brighter color so that you can see them differently or better, and then provide better lighting for those stairways as well. So the next slide, we're going to get into a few examples of cost containment opportunities, but again, without sacrificing the quality of care. The first few examples I would like to highlight, I think are relatable to all of us. It makes me think of when I see my physician. I want my doctor to hear me, and I mean really hear me and my concerns, so that we can determine the best plan for my care. If they don't listen and determine the correct diagnosis, they may have an aggressive plan, but that plan may not help or may not be the right one. So this is the same for workers' compensation and the team that manages the claims. The next few examples, I think, highlight how aggressive and attentive case managers can make a real difference, not only in the outcome of a claim, but also in the quality of someone's life. One of the worst types of injuries is a catastrophic accident. So these injuries are life-changing and often include permanent disabilities. We had a claim where a 55-year-old female was involved in a car accident during work and sustained a traumatic right leg amputation. Her case manager started the care plan right away. In doing so, the case manager needed to act quickly to cover all the important points, which included identifying the injured worker's immediate and long-term needs, evaluating the possibility of the injured worker returning to work in some capacity, and also the injured worker regaining self-sufficiency. Our case manager stepped outside of that checklist, if you will, for case management, and helped the injured worker become and stay motivated throughout the process. So as you can imagine, losing part of your leg could be very devastating and result in many difficult hurdles to overcome. Not the least would be to stay motivated. But only 16 weeks after her initial injury, the injured worker met all of her goals. The next hurdle would be for the injured worker to participate in vocational rehabilitation to facilitate that return to work. So listening can change lives. If we don't listen, we don't know what's needed to achieve the goal. And more importantly, we don't even know what the goal is if we don't listen. This is a great example of aggressive and attentive case management. Another example of how case managers can really make a difference is when they have a great relationship with the employer and the injured worker, and always try to find ways to meet the goals of both. The goal should obviously focus on best outcomes for the claim, but it may also include some areas outside of the claim itself. Good outcomes focus on the health and well-being of employers and injured workers, but that doesn't always mean just physical health. It can include can include financial health, such as the employer's premiums, or the injured worker's medical bills being paid on time. Mental health is also included. So if the claims are being managed effectively, that can alleviate stress from worrying about claims issues for both the injured worker and the employer. And this can also include spiritual health. Many times we see that injured workers struggle with their self-value when they're injured, and they may not be able to provide for their families like they typically could. And then the employers want to make sure that they're doing the right thing for the employees. I think this following example embodies how focusing on all aspects of a healthy workers' compensation program can have a positive impact on a person's life. This was displayed when we had a claim where the injured worker suffered an open fracture of his right lower leg. He went through many different treatment options, suffered some infections, unfortunately, and eventually he had to undergo a complete amputation from his knee down. So as you can imagine, this was a very difficult situation for all, but especially the injured worker. After the amputation, the injured worker was scheduled to be completely off work for 4 months. However, our case manager was able to coordinate a modified duty return to work, but the injured worker was hesitant, understandably so, about returning to work. But with the guidance and the encouragement from his case manager, he did go back to a modified duty position. And this was months before he was scheduled to do so. The injured worker was very appreciative of the case manager's assistance and expertise. He indicated that she had, quote, seen him at his worst and now at his best. In this example, an early return to work was achieved, excuse me, which saved the employer months of lost time, and the injured worker's life was greatly impacted. I mean, he said it when he commented about seeing him at his worst and now at his best. The quality of care was not sacrificed, and there were months of lost days saved. This is a win-win and an amazing example of listening and being proactive. The next example reminds us that there are real people behind those claim numbers. We had a claim where the injured worker fell off a trailer and hit his head. Unfortunately, he sustained a significant brain trauma. After he was released from the hospital, he was unable to go home because his house needed significant modifications. Therefore, he was placed in a rehabilitation facility for traumatic brain injuries. However, it got to the point where he could no longer stay at the rehab facility because he had increasing behavior issues. He was suicidal. He thought his wife abandoned him. He even broke out of the facility, actually ran into traffic, begging someone to call 911 because he said he was being held hostage. So we had a very difficult situation in front of us. The injured worker couldn't stay at the rehab facility any longer, but he couldn't go home. We wanted to find a place that was close to his family, but also a facility that could handle his needs. After extensive teamwork with the BWC, the injured worker's family and his attorney, and all the physicians and care facilities, we were able to do what seemed to be impossible. The injured worker was moved to a skilled nursing facility near his family, and one that was able to monitor his behavior and keep him safe. Not only was the quality of care an improvement, but it came at a savings, which ultimately could mean a savings for the employer. The initial rehab facility was $1,080 a day, but the new skilled nursing facility was $295 a day. And for those of you that are quick at math, that's a savings of $785 a day. Talk about a win-win. What MCOs do significantly impact lives. We listen, we identify the needs, we take action, and we aim for positive outcomes. We also need to make sure that we keep the claims cost about the claim. At times, it seems like other conditions are included in a workers' compensation claim. Some are appropriate and others are not. Make sure your MCO is watching out for underlying conditions sneaking their way into your claims. It's important to contain the cost to the actual claim and not conditions that are outside the accident. We had a claim where an employee was in a motor vehicle accident and sustained a shoulder strain. The employee had a degenerative shoulder condition prior to the accident. The case manager saw this older condition and proactively discussed it with the physician. So the doctor determined that the pre-existing condition wasn't related to the cause of the injury. Therefore, the treatment for that shoulder remained separate from the claim, the degenerative condition. This was all discussed with the injured employee, and he was able to return to work to his normal duties. So proactive, attentive case management, such as this, can save medical costs, potential lost time, and premium dollars. This is why it's imperative to have an MCO you can trust. Now we're on to the next slide. We're going to go over a few more examples. Now I want to talk a little bit about how knowledge is power. And this example reminds me of a wellness check or a biometric screening. Even though it's not always an enjoyable thought, at least for me it isn't, it is a necessary step to give us the knowledge to make changes and put a plan in place. Without that evaluation, we really just don't know how we're measuring up. No pun intended. Hopefully those waist measurements aren't going up. But that is where the wellness check or the biometric screening comes into play. You go in and oftentimes you're surprised with the results. Some are pleasantly surprised and some not so much. This next example makes me think of the not so much category. So in this scenario, we had an employer that just came on board with us. During our initial conversations, we discovered that this employer wasn't really sure how they compared with other companies in their specific industry. We requested their experience modifier, which is a tool used to measure the expected future cost of claims. We also requested the experience modifiers from other employers in their industry to do that direct comparison. And to much of their surprise, they had the highest experience modifier in their industry. Not so much good news for them. So we put a plan together with different steps. And some of those steps were that we reviewed and revised their injury reporting process by developing customized posters and creating injury reporting packets. We recommended that they extend their preferred provider relationships. That was mostly for the initial treatment, but it could also be for follow-up. We increased their team communication and collaboration with all parties. We also utilized field case management services, and that's when a nurse actually goes to and attends a doctor's visit with the injured person. We implemented quarterly team meetings, and we had frequent reviews of their claims using our claims trend report so we could monitor their progress. And it all paid off. Their experience modifier went from a 2.32 to a 1.16. Higher is worse, lower is better. And the number of claims that they had also steadily declined. They had a total of 24 at first, and now they have a total of 10. And in that number of claims, their lost time claims dropped from 7 to 1. So they are improving greatly. The employer did acknowledge that the improvements were due to the different implementations that they made since joining Sheakley Unicomp as their MCO. Another example I wanted to go over is sometimes simple steps just have a big impact. We had a very difficult claim. We scheduled regular meetings with all parties to proactively manage the expense of that claim. This injured worker needed to have surgery, but initially wasn't able to get the surgery scheduled for 6 months. However, we were able to step in, the case manager stepped in and helped get the surgery scheduled sooner than anticipated. So we ended up saving approximately 6 months of lost days. Again, lost days has the most impact on employers' premiums, but also if the injured worker has to wait an excessive amount of days for the surgery, it can have a negative effect on the injured worker's condition and well-being. And now I'll talk a little bit about the claim reporting and how I'd like to say that claim reporting time is of the essence. The sooner the medical experts, your MCO, can start to manage the claim, statistics have shown that the better the outcomes can be. Therefore, this is a statistic that we monitor here at Sheakley. We had a construction company that had a significant lag time in reporting claims. One of our client relations managers suggested that when an employee is injured on the job, they go to the doctor, get their initial treatment, and then they bring the paperwork back to the job site immediately following that initial treatment. And then she suggested that the employer report the injury to Sheakley that same day. Their reporting time went from 9 days to 0 days in just 1 year. This is important because the sooner the MCOs can start to medically manage the claims, the quicker the injured worker gets the treatment needed, and we can focus on return to work, with the goal to keep the claim from turning into that lost time claim. And then the last example I'd like to go over is focusing on knowing your areas of concern. I could use that wellness check or biometric screening analogy again, but I think once is enough. But we had an employer that we had several discussions and meetings with. It was a large employer. And we used our injury trend report to identify some areas of possible improvement. We discovered that their most frequent type of injury was sprains and strains. The employer then allowed us to attend one of their monthly safety meetings and provide some training on sprain and strain prevention. Their sprain and strains injury types went from 12 to 6 in just 1 year. And again, for those of you that are quick at math, that's reducing them by half. So that's a pretty good statistic. So that's all the examples I wanted to share with you today. I hope that you found that this was beneficial and that you're able to see at least a little bit of how proactive aggressive claims management and really listening can make a huge difference in workers' comp and also positively affect lives. Thank you again for your time today.
I would like to open it up for any questions. You can use your chat box. We do have the availability to, as you may or may not know, Lyman Chamber and Sheakley have been partners for over 30 years this year. They are our workers' comp provider and who we are able to provide discounts for our members with as well. So if you are interested in your MCO, you can either give the Lima Chamber a call and we can connect you with a Sheakley representative, or we can ask questions now, however you decide that works best for you. I learned a lot today, Andrea, so thank you very much for being here.
Thank you.
I do know that a couple questions came in. One was maybe somebody that came in a little later into the presentation, but one question was, is there, what is the cost for an MCO? Because I know earlier you had mentioned the BWC will originally sign one. So is there an application cost when this gets started, and how does that work?
No, there's no out-of-pocket fees for employers for MCO services. And initially you can select an MCO, or the BWC will randomly assign one to you. And then if you want to switch, that's when you switch during the open enrollment period. But we are actually paid by the state through the premiums that you pay for your coverage. It's based on the number of claims that we manage, but it is already built into that premium that you're paying. So there's no separate fee for us.
And that's a wonderful thing for businesses to know, because if the BWC is automatically, assigning because they didn't choose, because they probably don't realize that they have that option, then they might not be getting the same customer service that you were just speaking about, So I think that this is a wonderful program. We did record the session today, Andrea, so we will share it. We'll upload it on YouTube, and I can provide everybody here a link, and we will also put this on our YouTube channel and share it as much as we are allowed to. And really appreciate your wealth of information today and awesome partnership that we have with Sheakley. So thank you very much, and I hope everybody enjoys the beautiful day, and we will talk with you soon. Thank you for Sheakley and Perry Protect. So have a great day, everybody.
Thank you.
Thank you.